welcome. You're watching Medically Speaking, and I am Meenakshi Upreti. Joining me today is Dr. Anant Mohan. He's the HOD to Department of the Elite All India Institute of Medical Science. First of all, thank you for joining us, sir, on NewsX. My very first question to you, there is a lot of curiosity around obstructive sleep apnea or OSA, as it's known in a layman's language. Of course, this is post the death of Bappi Lahiri, who was suffering from this condition, sir. Help us understand what exactly is OSA, what causes OSA, and as far as a common man is concerned, really, what do the statistics say? Is it a rare disorder, a rare disease, or what all do we know about it, sir?
All right. So thank you for inviting me here. And yes, obstructive sleep apnea or OSA is statistically speaking, see, we won't call it either a very rare or a very common disorder. It all depends upon the diagnostic capability and also the population in which it is being talked about. But first, let us talk about what exactly is OSA. So OSA is a condition which is usually found in people who are overweight, although it can be in the normal weight people also. What happens is because of the excessive fat or whatever reason, the passage inside the mouth or the oral cavity, the passage of air is hampered, especially during sleep. So this person, when he's sleeping at night, then either he tends to mouth breathe, or by whatever other means, the amount of air which is supposed to go inside is not adequate. So the oxygen levels in the body are not adequate. And at this time, the sleep gets disturbed. He may have multiple awakenings at night. Sometimes he doesn't know that. And there are then several short-term as well as long-term consequences. One important condition here would be, the symptom would be excessive daytime sleepiness. So these people, because they are not getting a good sleep, proper sleep at night, they may be repeatedly awakening. And in the daytime, they feel very, very sleepy. And even during the routine activities, even when sitting in cars, in meetings, they may be going off to sleep at abnormal times also, which is not usually the routine. So this is basically what, in a nutshell, what it is all about. Of course, there are many other things involved in this.
All right. So talking about OSA in greater detail, my very first question is the causes of OSA. You said obesity is a major cause of obstructive sleep apnea. Tell us a little more about what exactly causes this particular disease.
Right. So the basic problem is hampered or less amount of air and oxygen that is going in, like I said. So whatever hampers that is the cause. And the most important causes would be an anatomical defects or lack of adequate sleep, lack of adequate space inside the mouth, which may be mostly because of fat most of the time, or in people who have got, say, a short neck, in which there again this passage is small, or in people who have got a kind of a condition in which the jawline is small, jawline is small. So again, because of anatomical problems, the passage of air inside gets hampered. So anything that anatomically disturbs, or in the nose, anything that causes blocked nose, deviated nasal septum, severely deviated nasal septum, anything that blocks the normal passage of air inside is one of the major causes of this particular condition. And then all these which I have enumerated are the risk factors, or the things that predispose a person to that condition.
Right. And how can someone cure this condition, sir? What is the diagnosis which is available?
Right. So the first thing is to diagnose. And before that, I would also like to talk about the symptoms. So the symptoms which I have said, it is very important for a person to know when to suspect such a thing. As you had already told, it is neither very rare nor very common, but awareness is lacking. So in the society, people don't know what is OSA, what is obstructive sleep apnea. So the thing is, a person who sleeps abnormally more in the daytime or at times when he's not supposed to do, he wakes up in the morning, but it doesn't feel fresh. He wakes up with headaches. He wakes up with, very irritable, even after spending 7-8 hours at night. So these are the symptoms when you should think about that you might be having some problem. One more important symptom is excessive snoring. Even though snoring is normal in most individuals, but these people usually snore excessively. And it is often told by the partner that he's snoring excessively. They may be mouth breathing. They may be waking up at night because the breathing stops at night. So these are pointers to recognize. then the diagnosis comes by a test which is known as a polysomnography or a sleep study, which we call as. In this, we usually it is done in the hospital in a very closed and a protected environment. There is a machine in which we attach certain leads to various parts of the body and the face, the nose. We measure the flow of the air. We measure also the brain, the inputs, the neural inputs, and the snoring, everything. So this tells us the person sleeps there the whole night, and the sleep is recorded, parameters are recorded, and based on that, a diagnosis is made. Now, coming to the treatment, the treatment of this, the most important treatment, apart from lifestyle changes, which I will come to later, is positive airway pressure therapy. So this is PAP therapy, positive airway pressure. This is in the form of a small machine. This machine kind of takes in air from outside. It pumps air through a tubing inside. There is a tight mask which has to be fitted to the face and the nose and strapped around the head. And then this air is blown at a particular pressure, forceful pressure inside. So it helps the air to go inside, because that is the main issue, isn't it? That is the main problem, that oxygen doesn't go in. So this, by forceful pressure, it helps the air to go in. This has to be strapped and used whole night to the patient. A whole night he has to sleep with this. And, with this over a period of time, many things improve and there is significant improvement. Right. Along with this, lifestyle changes are very important, the reduction of weight, physical activity, etc., etc.
So, sir, you spoke of two things. One, I'd like to dwell a little more on the symptoms, because the symptoms seem to be very subtle. Nighttime awakenings, excessive snoring, waking up with a headache is quite common. Is it likely that many patients, those who could be suffering from OSA, could end up completely ignoring these telltale signs? And if it's not diagnosed early, can it be dangerous, as we have seen in the case of Bappi Lahiri as well?
Absolutely. That is why I'm saying it is an under-recognized, under-diagnosed disease, because awareness is not there. And the signs are like this. So the commonest sign would be the excessive snoring, loud snoring, and excessive daytime sleepiness. There are various questionnaires in which we suspect, but these are all meant for hospital use. For a layman and the general public, they will have to understand somebody who's excessively snoring at night, he is not feeling fresh in the morning, even after spending 7-8 hours in bed, or if he starts sleeping while driving. So driving is an absolute no-no unless cured of the OSA, because in fact, one of the major causes of accidents is obstructive sleep apnea in the Western countries, and probably here also, but we don't know the statistics. So somebody may fall asleep while driving, especially if going to long distance on highways, when you are just driving at a particular speed, even a normal person starts feeling sleepy, isn't that happens? So in an OSA patient, all the more dangerous. So these are signs. But in a predisposed person, suppose who's overweight, then I think if awareness is there, then one should seek medical attention as soon as possible.
And that was going to be my next question. You've answered it partly. If someone has been diagnosed with OSA, what would be your, advice to them? One, of course, is to avoid driving.
Correct. So if he's been diagnosed recently, then of course, apart from the treatment, we have to make sure that he doesn't do any activity which may be risky, and driving, of course, is something which is risky if he falls asleep. So he should be always accompanied by somebody, or he should be using a driver, or any other activity which if done alone can be risky. It should not be, especially if in a closed environment where he's alone and there is, and there is a chance of falling asleep. So that also, these kind of things have to be taken care of. Having said that, most of the people, if they use this positive airway pressure therapy well and properly, after a few weeks, a significant improvement in the condition is seen in a majority of people. So that is a positive side of the whole thing also, that take the treatment properly. It may look cumbersome. Taking a mask the whole night long for many months to years may look cumbersome, but over a period of time, when they feel the benefits, then they realize that the benefits are far more than as compared to the inconveniences.
Right. And my last question to you, sir, you spoke on lifestyle changes. Of course, as far as OSA is concerned, one of the major reasons for someone getting it is obesity. What are the lifestyle changes which one needs to make? And also, just a side note, is it men, is it women who is more predisposed to get OSA, or, or gender doesn't have much to do with it? Is it mostly obesity and or related to your weight?
Yeah, one question which you asked earlier was, is it dangerous? So it may be, so we have talked about the dangers of driving, etc. But even in the long term, obstructive sleep apnea has indirect effects on many other important organs of the body. And the most important one being the heart and the circulatory system. It is strongly associated with various heart disorders, including the risk of heart attacks, strokes. It is strongly associated with diseases like diabetes, and we know diabetes itself is a major killer. So basically, it's I won't say it's a disorder of the urban, but I would just say that it's a lifestyle related disorder which is associated with many other similar type of disorders as well. So all those things also have to be kept in mind. And hypertension, yes, high blood pressure is associated with sleep apnea. So altogether, it makes OSA a pretty important cause of morbidity and death and illness and sicknesses over a long term. And one important thing is these patients may have respiratory diseases also, like COPD and asthma, etc. There are entities which are called overlap, COPD, OSA overlap. They have respiratory failure. They go on to develop respiratory failure, which may be life-threatening, and that is the major chunk that we see in our population, in the patient that we treat. So that is one part of the danger part of the OSA. Then the next thing you talked about was the gender part. In gender, because no, there is no preference of gender, but yes, slightly more in males, I would say. Apart from obesity, we have already talked about the other risk factors. Diabetes, hypertension, coronary artery disease already are associated. So I think, was there any other question you wanted to ask? I forgot.
Comorbidities which exacerbate the disease, but when we speak of the lifestyle modifications, as your parting remark advice to those watching the show today.
So again, the same thing, the same things that we keep repeating, reduction of weight, various measures to try and reduce weight, active lifestyle. But specifically for OSA, some things may be to sleep in a lateral position, not to sleep, facing up, face on the side, sleep facing on the side with the head slightly elevated. These are some things that help in the breathing pattern at night, and also help in, so various things of the posture are there. So these are some things related to OSA. Treatment of diabetes, hypertension, treatment of all underlying comorbidities is equally important. Activity is important. So, and correction of all modifiable factors. For example, if there is a deviated nasal septum, unless we correct that anatomical defect, the disease may not go away. So treatment of the underlying cause, wherever known, is also important. So all this together makes up the management.
Well, absolutely. Management of the disease, end of the day, is key. Manage your weight. Obesity, one of the major reasons for OSA. It's rather unfortunate that the death of a personality has got us to talk and to focus, on a disease like this, prevalent, but very little awareness, very little talked about. I hope we've been able to contribute a little bit to that conversation. For now, thank you, Dr. Mohan, for joining us and giving us your
experience.
Thank you, sir.
Thank you very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.